Hi, everyone. Welcome to the second episode of Distance Discussions. I am lucky to be joined by my dad, Dr. Marc Kress, and he is here to help us understand a little bit more about what's going on with coronavirus. So, Dad, thanks for being here. First, just tell people what kind of doctor you are, how long you've been practicing medicine. Tell us a little bit about you.
So I've been in practice for 35 years in general family medicine, and more recently as a geriatrician, board
Great.
certified both.
And tell me about your at home outside Philadelphia in the suburbs. So tell us what the state of coronavirus is where you are.
Well, we've had two cases occur in our own practice so far. Neither of those cases are what I would call classic cases, as the symptoms were mild on both occasions. The county that we live in, which is adjoining Philadelphia, is the highest county to have cases compared with Philadelphia. So we are second in the state, according to the most recent statistics that I looked at for involvement in this county.
And in Pennsylvania, or Montgomery County specifically, it's pretty much everything shut down except essential businesses, right?
That is correct.
And tell me a little bit about what testing has been like for you in your practice and, more generally in the area.
So testing is presently available to us through commercial labs. We can use Quest and LabCorp to get the testing that we need, but our supplies for testing are limited, and we have not been given any guarantees that we will be able to replenish those kits once we exhaust them. There is the potential for some area hospitals offering drive-through testing, but they are requiring very severe symptoms to justify being able to utilize those sites. So they require a fever, they require shortness of breath and a cough to justify the testing at those sites. We are less stringent, following more of a general guideline that testing can be pursued for anyone who has respiratory symptoms. We are not testing asymptomatic patients yet because we do not have inexhaustible supplies, but we are able to do a bit more testing than what's available through the local hospitals. So for right now, when we need the kits, we have them, but we are holding off on asymptomatic patients, and we know that we have a limited resource at this point with no certainty of being able to replenish supplies.
And what is, from your understanding, the reason that there's such a lack of resources for testing?
My understanding is that unfortunately the systems that are generating these kits are simply unprepared for the volume of kits that need to be manufactured. So there is a ramping up of manufacturing, but there is definitely a delay, and we are not being told exactly how long that delay may be in place until the kits are readily available across the board.
And, I think it's been frustrating to a lot of people to see wealthy people, celebrities who aren't, experiencing symptoms be able to get tested. Why do you think that that's happening?
I think, unfortunately, that wealth allows for access, and they've been able to access those testings whether they need the test or not.
Healthcare in America. Can you clarify? I think there's still some uncertainty among a lot of people about how the virus is actually spreading. So can you tell us how it goes from one person to another?
So the most significant mode of transmission happens to be droplet transmission. So when an infected individual coughs or sneezes, droplets from those result in transmission to the immediate vicinity. So the idea of remaining 6 feet apart from each other is established not randomly, but because they feel that that droplet does not have the potential to spread beyond that radius. So as a result, by staying clear, you limit the droplet exposure. There can also be transmission from contact with surfaces that may carry the virus. This does not seem to be as likely a source of transmission, although it certainly can be, because the virus can remain on surfaces for actually days. So, so it does make sense to clean surfaces and to keep one's hands washed diligently.
And if someone coughs or sneezes into the air, can that stay in the air?
It does have the potential to remain for probably a couple of hours. So there is that potential. Again, that is a less likely mode of transmission, but it is possible. So it's not the prominent mode of transmission, but it can travel a bit more through aerosolized transmission.
So if people are getting takeout or they're going to the grocery store, should they be, wiping everything down with a Clorox wipe, to prevent transmission, even though it's less likely in that way?
I think it's a reasonable consideration, but I think more importantly is that when they've concluded with that contact, that they think about washing their hands, which is a ultimately more effective strategy of washing their hands for a true period of 20 seconds, which most people do not wash for that kind of duration. And also focus on what's also been recommended, to avoid bringing your hands to your face, because the way this virus gets access to the body is through openings. So your mouth, your nose, your eyes are the access points for the virus to enter the body. So if you avoid bringing hands that might be contaminated to your face, you're going to certainly reduce the chance of exposure. And so effective hand washing and avoidance of your face is really a good strategy. Whether you clean the surfaces that you're using in public, I think is really a secondary issue, as long as you're effectively hand washing.
Well, I think I speak for everyone in saying that since we've been told not to touch our hands, our faces have never been itchier. There is a compulsion to touch my face now. So you are both a doctor and a small business owner. You own your own practice, which, for a family practitioner isn't so common anymore. So tell me how this is affecting you as a small business owner.
Well, it's more or less devastated the business side of the practice, because previously we would encourage patients who were sick to come into the office to be seen and evaluated. Now the guideline would say just the opposite. We're telling people with their mild illnesses to stay home and recuperate at home and not be evaluated in the office. Also, patients that were due in for healthy visits, wellness exams, and other reasons, blood pressure checks, are basically staying away because they don't want to come in contact with any potentially infected persons. So as a result, our volume is significantly down. We've had to lay off staff. We are reducing our hours, and we are giving up our evening and weekend hours that we had to try to condense the hours, reduce our manpower, and still be able to provide the necessary care for those who do seek our opinions.
Yeah, so I think it just exemplifies how hard this is hitting every industry, even the medical industry that might seem like that's the one industry that's still, chugging forward, that, that it's still really hurting a lot of practices. What would you say is your number one piece of advice to people? You already said everything about washing your hands, but anything else that you want to tell people?
I think that in addition to being safe by avoiding keeping that 6-foot distancing. Social distancing does make sense in this situation, and the effective strategy is hand washing, avoiding face for sure. I think that there is a lot of fear, a lot of panic of the unknown, and I believe that that is adding to the overall situation in a negative way. So I think that people need to grasp the real probabilities of themselves contracting the virus, and they, for each individual, providing they're doing the proper precautions, their actual risk is relatively small at this point. So I think that the excessive worry, the excessive fear is unsubstantiated. Obviously, we all have concerns about where this is heading, but I think that thinking logically and practically and rationally makes a lot of sense at this particular time.
Are there any myths out there about, the virus, about how you cure the virus, anything like that that you want to debunk?
Well, I certainly heard the president the other day talk about the results of chloroquine as one possible therapy. And these kinds of treatments are not on the immediate horizon. I mean, they have to do some significant research to see whether there's going to be any effectiveness for that kind of treatment. I think that the fact that they're working very diligently on trying to come up with vaccinations and trying to come up with therapies is a good thing, but to think that this is coming within days or weeks is completely unrealistic. And then daily or frequently, we're finding reports that something is beneficial or something may help mitigate against this particular virus. And each time these predictions or these myths have been debunked. One such idea was that ibuprofen could worsen the effects of the pulmonary reaction to the virus. And that seems to be negated with the most recent research, or at least comments that I've seen. There was a report that staying hydrated and drinking a lot of water would flush the virus from one's mouth so it wouldn't get into your lungs. And also, despite the fact that hydration certainly is a good thing and certainly to be encouraged, it does not seem to mitigate the chances of contracting the infection.
Okay, good to know. I think I've heard all of those things, and so it's good to have some facts behind that. What should people be doing if they feel sick? And I think, the main symptoms of coronavirus are, respiratory issues, a cough, and perhaps a fever. Is that right?
So that was the way it was presented to the public, that those would be the main symptoms to be on the lookout for. But I think more recently what's come to light is there also can be digestive symptoms. So the illness could be initiated by diarrhea and not respiratory symptoms. Diarrhea would be an early symptom that then would become lung symptoms after that fact. So you do have to be on guard for GI symptoms as also a possible preliminary symptom of this COVID infection.
And so what should people do if they're feeling sick or showing any of these symptoms?
So basically, I think that they need to make contact with a primary care provider. Hopefully they have a primary care provider, but their first step before they would initiate taking themselves to a facility, to their doctor, to the emergency room, would be to make phone contact and discuss what their symptoms are and where they should take the next steps, basically, in terms of treating themselves or needing the assistance of the healthcare community to either be tested or to be evaluated. So the first step would be to keep yourself self-quarantined, contact primary care, and make that discussion in terms of whether or not a further service would be needed. The outcome of that discussion may be just to sit tight and ride out the symptoms, which would be a change in the way that healthcare has addressed these kinds of respiratory problems in the past. But we're trying to keep the contact between patients or persons to a minimum. So we are not seeing everybody just because they have minor symptoms. And the patients with enough symptoms to warrant testing, we make arrangements for them to be tested, whether outside the office, which we've been doing with some patients. We've been seeing them with one of our assistants fully in protective gear, taking the appropriate swab outside the office so they don't come in and contaminate our staff. There are others who with a bit more symptom presentation that would require an evaluation, so we are bringing them into the office. And those which meet the criteria for drive-through testing at the hospitals, we refer to that treatment option, or at least evaluation option. So we're dealing with it depending on the symptoms in different ways, but the initial patient response should be contact a healthcare provider. Don't take it upon yourself to show up in an office or to go to the emergency room on your own without being instructed to do so.
And so if you don't have a primary care provider, going or calling urgent care is an option, right?
Urgent care would be a definite option if you have no contact with your own primary nurse practitioner, PA, or physician.
And one of the things you did that I thought was really great was you actually worked with your landlord to use a vacant space next door to separate out patients showing symptoms from patients not. Is that right?
So we're very fortunate that we had an empty medical suite next to ours, and the landlord was gracious enough to allow that suite to be utilized by us rent-free under these pandemic circumstances. So we've converted that space into a healthy side of the practice, so patients who need their wellness exams, vaccines, a blood pressure check, anything that would require a non-ill visit can be done knowing that it's a safe zone of no infected patients being in their vicinity. So it's a infection-free zone. So patients have welcomed that option and that opportunity to still be seen and not have to cancel an appointment, and feel confident that they're less likely to contract any illness.
Yeah, I think that a situation like this requires a lot of innovation and ideas, and I think that's just one great way of continuing to keep things running and being able to see people. And also, the landlord, whoever they may be, providing that for free. I think everyone kind of coming together and doing their part.
Yeah, and the other thing that we've tried to do is provide testing for patients that don't quite meet the strict criteria that the hospitals require, and that rather than have them expose our staff, we've been seeing them outside of the office, literally having them drive up, and one of our staff runs out and swabs them for the test without exposing anybody in the office. So it's another adaptation that we've tried to provide to accommodate the situation.
So you're essentially kind of doing your own drive-through testing.
Exactly. Exactly.
What more? So you're in Pennsylvania, I'm in California. I think both of the state leadership has, done a pretty good job of responding and making decisions quickly. So in terms of the federal government, what more could the federal government be doing to address this pandemic?
Well, I mean, on one hand, they're certainly working at the vaccines, they're working at the medications, the NIH is actively pursuing this. So, they're doing what they can do. Obviously, a time factor is the limiting situation because it's not going to happen anytime soon. I think what the federal government could do would be to facilitate the distribution of supplies. I mean, they've got the resources, both civilian and military, that could be accessed to assist with providing supplies to medical communities. We are short on all supplies. We literally have one pair of goggles to utilize for all our 4 providers and for the staff. So we have to share one pair of goggles. We know we're going to run out of masks. We have a limited number of appropriate N95 specific masks, and we're forced to reuse those masks. We have only so many limited gowns, and the likelihood is that the condition is going to be ramping up, not subsiding in the near future. So we know we're going to have a shortage of supplies. We already do. So the government needs to activate all resources to not only produce these supplies, but distribute these supplies. So I really feel like that's where their mission should be focused. And for them to claim to put it on the state's responsibilities, I think is a failure of the federal government for what they could do to help the situation.
And where are you getting your information and your news about developments, as this, is constantly changing every day?
My antenna are up to multiple media sources. I follow the CDC guidelines, which gives an update on a regular basis. Our specialty organizations provide us with information, newspapers, media, anywhere and everywhere that I can access information. I'm keeping up with this because it's changing so dramatically. It's such a fluid situation that day to day there's new information, and we've got to stay informed in order to provide the best care for our patients.
And how does I don't know if this has been happening, but if the federal government has something to communicate to doctors specifically, how does that information get disseminated?
I'm not sure what their line of communication would be, but I certainly think they could communicate to state health departments, and the health departments could then disseminate information to us through emails, et cetera, or through the specialty organizations. So I believe there's a lot of resources at their disposal to disseminate new information.
There is a lot of different information. There's a lot of different models, but from what you've seen, do you have any sense of how much longer, we're going to be in this situation? How long until we might return to a sense of normalcy?
The challenge is I certainly don't have a definite sense of this. I know that it requires that the attack rate, the number of patients that are going to be contracting the illness from an infected individual right now stands at somewhere between 2 and 3. And until that number is less than 1, this pandemic is going to continue to escalate. So the question and the hope as to whether the virus shows temperature sensitivity, and that when the weather warms up, whether that will curtail the reproduction, the vigorous activity of spread that's going on with COVID, whether it responds like an influenza virus and will diminish as the warmer weather hits, or whether it's completely independent and continues right through the summer months, is very unknown at this time. Looking at world trends, it does seem like the virus has a propensity to cooler climates. There's a band of high volume infection in higher latitudes than in truly the most hot regions of the world. Whether that actually translates to summer months providing relief for us, or whether somehow the virus will continue to propagate through that time frame, will certainly be impactful on what we see going into the spring and summer months. But right now, I don't have any prediction on what's going to happen.
All right. So my last two questions I'm asking everyone I interview, and the first is, what is one piece of culture, book, TV, movie, music that has been providing you comfort or a distraction during these times?
I would certainly say distraction. I just finished a book called Never Caught, which chronicles the life of one of George Washington and Martha Washington's slaves, and her quest for freedom. And she escaped the Washingtons when they were in Philadelphia, managed to find her way to New Hampshire, and managed to live out her life, escaping attempts to um, basically capture her and bring her back to slavery at Mount Vernon. So it was an interesting storyline that I had never heard before. Um, Otherwise, I find myself enjoying streaming of series that I'm catching up on, such as Billions, and I just started Plot Against America.
So my brother and my dad are both watching Plot Against America. We know from our distance discussions. And finally, what's something that has inspired you or given you hope, in these recent weeks?
Well, I was highly encouraged and found it most rewarding that after speaking to a patient about the situation and the healthcare situation and our need for masks, she, being an artist, had a unused box of the necessary masks that we needed, and was willing to donate that to the cause. To help out, feeling very appreciative that we were remaining open, that we were there for her, and she wanted to reciprocate in some kind of way, and proceeded to write on the box of masks when she dropped them off how much she appreciated our efforts. And so just to know that kind of patient response is very satisfying and fulfilling, and justifies our efforts and our exposures and our risks that we take to try to help and benefit our patient population.
That's an awesome story. And I think there's a lot of talk right now about whether it's artists, tattoo parlors, contractors, painters that might have, these masks available or other supplies available, being able to give them to frontline healthcare workers is really important right now. So that is the end of our second distance discussion. Thank you so much for being here virtually and answering a lot of questions that are on people's minds. And if people have other questions that come up in the coming days, please let me know, and I will try to get answers for you. And hopefully see you next time on our next distance discussion. Bye.